Calvinson is a practicing physician and clinical assistant professor in emergency medicine. He joins us now from New York. Dr. Sun, thanks for being with us. First, how important do you think is the approval of some of these non-Western vaccines?
Depends on where you are exactly. So in New York City, I'd like to have the backup of a peer-reviewed journal on the vaccines that we've had. I have 2 Pfizer shots in me right now. It's been 2 weeks since my second dose, and I feel amazing, and partly because the data reviewed was by an independent journal that had nothing to do with BioNTech or Pfizer, and it showed 95% efficacy. I had an independent review. Now, if I were in a country, a developing country that did not have access to Pfizer or Moderna, and I had an option of not having a vaccine versus one of those the Russian or the Chinese vaccines, it really depends on how dire the situation in my community is, if I would want to wait or take it, because they are not peer-reviewed. Other than the Chinese one, which was reviewed by Brazil, they showed a 50% efficacy, at most 60%. That's what Brazilians are saying about the Chinese vaccine. And that does give me pause, because 60% is not good as 95%. But if I have no other choice, I might be tempted to take that and then get a better vaccine later.
Of course, I'm sure you'd agree, though, that 50% is better than 0% in some of these places. I assume that's your point.
Yes, it depends on where you are.
How likely is it that Americans might ultimately get some of these vaccines?
These vaccines will probably not reach Americans because the abundance of Pfizer and Moderna taking over the market in its terms of its first availability and the fact that it already has all these contracts with hospitals and federal governments, and they already bought all of these things. So it kind of drowns out even AstraZeneca's or Johnson & Johnson, because in the United States of America, we prize first come, first served. It's a capitalistic, that's how our economy runs. You're there first, and you get all the attention, and you have strong efficacy, and you're independently reviewed by things that have nothing to do with the people inventing them or manufacturing them. That's a really good buy-in. And now there's low supply, and that also creates an American concept of we want it, especially when we can't get it. People always want what they can't get. So I don't know if that was done on purpose or the fact that the federal government dropped its ball. I think the latter is more believable. It is creating a lot more buy-in than we did see 2 months ago.
You're talking about some of this concern that the federal government, the supply just isn't keeping up, and that even where there is supply, there's really a holdup in distribution for various reasons. But do you expect this to be overcome?
When the new administration takes over and all goes well and they stay true to their word and there's a drastic improvement, I think relative to what we've been through in the last year, it's definitely hopeful. And I think I do know
but
that
Dr. Sun, I just want to play devil's advocate here, because some of the logistical problems have been things like the low temperature required, the miscoordination at the state level. Are you suggesting that Biden will solve this on day one?
Absolutely. Moderna does not require low temperature. You can store it in regular refrigerators. I gave Moderna vaccines last week, and I was giving them out like candy, and they were stored in a regular refrigerator. Pfizer requires a hospital-level refrigerator of -70. The Americans have the capability and apparatus to distribute in a disaster-level mode with its military to mass vaccinate the entire population. It just was never activated by the previous administration. The current administration can activate that if they choose to. If they don't choose to, then it will be harder to overcome. But we don't know until we get there.
And what about Johnson & Johnson? I mean, we are expecting them to enter the market at some point soon, a traditional vaccine. Have we heard anything about its efficacy? And I imagine it would help the logistical problem, being that it's a single-shot dosage.
So yeah, we're looking for the peer-reviewed articles on Johnson & Johnson. Now, the New England Journal of Medicine, that is like the creme de la creme of reviewing articles and data. Basically, their stamp of approval means it's the gold standard. Has reviewed mRNA vaccines like Pfizer's and Moderna, and has given its stamp of approval. We have not seen that to the level of Johnson & Johnson, and definitely now nowhere close to the 95%, but the single shot makes it more practical. And I do value that pragmatism, where to get one shot is still better, as you said, better than nothing. But we have to wait for that data to come out. And Johnson & Johnson is, a reputable pharmaceutical company that, delivers good products. So I'm hopeful, and that one shot is still, as you said, better than nothing.
Dr. Calvinson, thank you so much for your insight.
Of course.